Good afternoon. I'm Adrian Dix, BC Minister of Health. To my right is Dr. Bonnie Henry, the Provincial Health Officer for British Columbia. We're honored to be here on the traditional territory of Lekwungen-speaking people of the Songhees and the Esquimalt First Nations. We'll be briefing here tomorrow at 3 o'clock as well. And with that, I'll introduce Dr. Bonnie Henry.
Thank you and good afternoon. For our update today, to start with, our number of new test positive cases is 43 today, which brings us to a total of 1,013 people in British Columbia who've tested positive for COVID-19. Of those, 476 were in Vancouver Coastal Health, 348 in Fraser Health, 67 now on Vancouver Island, 107 in the interior, and 15 in Northern Health. In addition, we're up to now 19 long-term care homes or assisted living facilities, all of them either in Fraser Health or Vancouver Coastal Health, where we've had outbreaks of COVID-19. I will say, however, that this reflects a very low threshold for declaring an outbreak, and all of the screening that we have been doing and focusing on in terms of trying to protect our long-term care homes. We know we have two particular outbreaks that started early on, the Lynn Valley Care Centre, of course, and the Harrow Park Care Centre. And both of those are really full-blown outbreaks where we have a number of both staff and residents who have been affected, and unfortunately that is where we have had most of our deaths. But the other ones really reflect the fact that we have taken such an aggressive approach to monitoring, to testing, and to preventing illness coming into our long-term care homes. And the fact that we now have 19, but the vast majority of them have a single person, either a staff person or a resident who was detected with this illness. And we've been able to put in place the outbreak measures so that others are not affected, and people are effectively isolated or removed from the home in terms of the healthcare workers so that we aren't transmitting it. And I think that's a really important thing to recognize. So currently, as of this morning, we have 128 people who are hospitalized across the province with COVID-19, and of those, we now have 61 people who are in ICU. So the ICU number is very close to yesterday, although I will say, as I mentioned yesterday, people go back and forth between the ICU or the high acuity units. We have had a policy very early on of ventilating people early to help them recover from this, and that is reflected by the numbers that are going in and out of ICU on a daily basis. So that's the census as of this morning. It's not the same 60 people that were in ICU yesterday, but it is the number who are now receiving critical care. We have 507 people now fully recovered and out of isolation, and we have an additional 5 deaths, unfortunately, 4 of them in Vancouver Coastal and 1 in Fraser Health, bringing our total fatalities now to 24. In addition, I want to report today, Interior Health is investigating our first large community outbreak, which involves a group of temporary foreign workers in housing at a West Kelowna agricultural business, Bylands Nursery. So this business has been closed to customers. Interior Health became aware of a number of the workers there with respiratory illness, and a number of them have now tested positive for COVID-19. The business itself is being quarantined, and everybody is able to be isolated effectively in the housing, the very good housing that is on site there. And we want to thank both the workers themselves and the owners and operators of the nursery in being fully cooperative, and everybody is being cared for very well, and the investigation is ongoing with Interior Health on that community outbreak. There's a number of things, as you're aware, that we've issued some guidelines on that have come out recently on the orders that we've put in place over the last little while. These guidance documents have come out so that we can have some consistency in the applications of the orders that we've put in place to protect people here in BC. So yesterday there was some detailed guidance around industrial camps, Later today or early tomorrow, we'll have some guidance for municipal bylaw officers and other law enforcement officers. And while I can call on peace officers to help enforce orders, it is a last resort, as we talked about before. The way that we need to work together on ensuring that people are taking the measures that we need them to take, whether that's being in quarantine if you've been a contact of the case, whether that's being in isolation if you are sick yourself or you return from travel to a country outside of Canada. Those are legally enforceable orders by public health, but we know that most people are doing what we're asking them to do and are doing the right thing. So that is the approach that we need to continue to take, that we're all in this together, and that allows us to ensure that people aren't hiding things and aren't afraid of coming forward and working with us if they become sick. One of the other things that we have done in the last week is put in place a protocol, our first responder dispatch protocol for the pandemic. And this is really an important way to protect our non-paramedic first responders. As you may be aware, for many calls to 911, dispatch will dispatch not just a paramedic, but if, in particular our first responder firefighters who are trained in advanced first aid and other measures. And during a pandemic, when we know that personal protective equipment is so important for our healthcare workers, for our paramedics, and we want to avoid exposing as many first responders as possible, the protocol allows for paramedics to be dispatched only to most medical calls unless there's a need for backup from either police or fire services. So I think that's a really important measure that we want to make sure protects our non-paramedic first responders and ensures that our paramedics are able to respond effectively with the personal protective equipment that they need. Finally, I'll just say we are, as I mentioned yesterday, at a critical juncture. We are watching very carefully across the province. We are still testing around the province. We're testing our focused areas, as we've mentioned, on long-term care, on our hospitals, but we are also continuing to do our surveillance, our testing of any swab that is sent into the lab for respiratory testing, and our influenza sentinel surveillance network. So these are really important measures to help us understand what is happening. And this is our critical time here in British Columbia, the next 2 weeks. We must be true to who we are in BC, and we know that all of us, most of us, are doing the right thing 100% of the time. No one is immune to this virus, but everyone can make a difference. So we need you to do those things that we've talked about. Avoiding unnecessary travel, particularly to smaller communities where they may not be able to support you if you get sick and where we don't have as many resources. If you're older and you're more likely to have severe illness from this, please stay at home to reduce your risk, and we as a community will support you to do that. If you're younger, stay apart. That is our duty, to make sure that we're not connecting and transmitting this virus between us and bringing it home to those that we care about in our family and our community. So this is the time, as we've said in the last couple of days, it's to be 100% committed to keeping this curve flat, to not allowing a surge and an outbreaks in our communities. So taking care of our loved ones by doing your part, by staying home if you can, by staying apart, and of course by staying connected virtually.
Thank you, Dr. Henry, and I know on behalf of everyone watching us today, we want to extend our condolences to the families of the 5 people who've passed away in the last day, of the 24 people who've passed away from COVID-19 since the beginning of this epidemic in British Columbia, and we are, of course, thinking of them every day. I want to talk briefly about where we are in acute care, as I have in the last number of days. Dr. Henry talked about the numbers in general. The acute care numbers are 55 in Vancouver Coastal Health, 53 in Fraser Health, 8 in Island Health, 7 in Interior Health, and 5 in Northern Health. And as Dr. Henry just said, the numbers in ICU remain relatively stable. I think there's one more yesterday today than yesterday. want to put it in context, we have, as of today, 4,171 beds, empty beds in our acute care hospital system in BC. That's slightly less than yesterday. Those numbers I expect to bounce around a little bit now more. We've had really the full effect of the cancellation of elective surgery and of a lot of the measures we've taken to provide alternate level of care patients who can move from the hospital to get the access to the care out of hospital that they may need. So that's roughly 61% of acute care capacity filled right now, and 53.8% of critical care capacity. I want to say to people that a huge contribution to that, of course, to those numbers, is the fact that elective surgeries have been canceled. And I know a lot of people have made a lot of sacrifices this month, especially since we started the measures, the social measures, to stop the spread of COVID-19, but nobody has sacrificed more than people who are waiting for surgery. And I just want to say to all of them, while the surgeries have been canceled for the moment, they have not been forgotten. And I expect, both personally and the whole health system, to, once we get through this, at whatever point that is, to move with as much energy and passion and compassion in addressing their surgeries as we have in dealing with COVID-19. I want to say a couple of things that we talked about yesterday about what's happening in the community. BCEHS, which is the ambulance service, ambulance paramedics, are responding to many more calls for influenza-like illness than they usually do. But the number of calls is relatively stable. Just to put it in context, on March 23rd, which was the previous Monday, there were 331 such calls. And this past Monday, there were 294 calls. And to put it further in context, there were 1,333 overall calls on Monday, March 30th. That compares to a normal average of about 1,540 calls. That doesn't mean there isn't extraordinary work being done by the ambulance service. Quite the contrary. The work of ambulance paramedics is something we're very proud of. Also want to stay with pride how honored and how we will not forget the work being done by those who keep hospitals clean, who provide food and other services in hospital, who deal with the laundry and deal with security in hospitals. That group of workers and their commitment is extraordinary. It deserves to be recognized by people every single day, and their contribution at this time when we need them most will not be forgotten in BC. Another group of professionals that is important are people who have been retired and have come back to their professions. We're now up to 35 doctors and 444 people in nursing. That's LPNs, RNs, RPNs, which are registered psychiatric nursing, nurse practitioners, and healthcare assistants. And in addition, some 530 allied health workers in private practice, OTs and dietitians and physical therapists have volunteered to return to the public system and to work in the public system should their work be required. Finally, I want to just bring you up to date on equipment. Last week we announced that there were 50 new ventilators had arrived in BC. 15 more ventilators have now arrived for a total of 30. Last week we announced that 38 ventilators have been refurbished. 15 more have been refurbished for a total of 53. So that's 83 ventilators beyond the 1,272 in the whole system. But those have an enormous, if you'll remember the slides we presented about ventilators last Friday, having those 83 ventilators available for adults is important. In addition, 53 other ventilators, which are currently designed for pediatric care, have been adjusted so they could, if required, be used in emergencies for adults. Finally, I just want to say that this is an important time, and these 2 weeks are very important. Dr. Henry has said it, doesn't need to be really said again, but I'm going to say it again. We need 100% commitment now. This is a crucial moment in BC. Your friends depend on it, your family depends on it, the people you love depends on it. All people in the community depend on us coming together and having a 100% commitment to what we need to do. It's more important now than ever. We need to support our healthcare workers every day and every minute of every day. And we need to support our essential workers every day and every minute of every day. And we need to support each other to get through this with the best possible result. It's not an easy fight, but if we're in it together 100%, we will be able to to the maximum extent possible, bend the curve. And that happens by following Dr. Henry's orders. Juste quelques mots en français. Nous annonçons aujourd'hui 43 nouveaux cas pour un total de 1013 cas en Colombie-Britannique. Chaque régie de santé de la Colombie-Britannique compte des patients atteints de COVID-19. 476 se trouvent à Vancouver Coastal, 349 à Fraser, 67 sur l'île de Vancouver, 107 dans l'intérieur et 15 au nord. C'est avec tristesse que nous signalons 5 décès dans les régies de santé de Vancouver Coastal et Fraser au cours des dernières 24 heures, pour un total de 24 décès liés au COVID-19 en Colombie-Britannique. À ce jour, 507 personnes dont le test de dépistage de COVID-19 a été positif se sont rétablies et n'ont plus d'exigence d'isolement, ce qui est une bonne nouvelle. Sur le total des cas de COVID-19, 128 personnes sont actuellement hospitalisées, dont 61 en soins intensifs. Et les autres personnes atteintes de COVID-19 se rétablissent à la maison en s'isolant elles-mêmes. Nous sommes à un moment critique et notre réponse provinciale, de notre réponse provinciale COVID-19. Au cours des 2 prochaines semaines, nous devons tous faire la bonne chose et nous engager à 100% à aplatir la courbe. Personne n'est à l'abri, mais tout le monde peut faire la différence. Si vous êtes plus âgé, restez à la maison et vous éloignez de ceux qui pourraient vous mettre en danger. Et si vous êtes jeune, restez à l'écart signifie que vous conservez de la place dans notre système de soins de santé pour nos aînés et les personnes les plus à risque. Thank you very much, and we're happy to take your questions.